So, a video of me showing that. Video around the room. Right. Me and you. All right. Hello. My name is Alicia. I'm going to be your nurse practitioner today. I heard that you're having some issues with your throat. I'm just going to wash my hands and close the door and provide some privacy for you before we get started on that.
Okay.
Door's closed. Hand sanitizer. All right. So tell me a bit about what's going on with your throat. How long ago did it start hurting?
3 days ago.
Okay. Can you describe the pain for me? Is it sharp, stabbing, throbbing, burning?
Burning.
Okay. What makes it worse?
Eating.
Eating, okay. So just swallowing in general, or is it
Yes.
foods? Okay. Anything make it better?
No.
No, okay. Have you tried any over-the-counter pain medications, lozenges, increasing your water intake, any kind of salt water gargles?
Tylenol.
You've tried some Tylenol, but it didn't help. Okay. Any white patches on your throat when you look at your tonsils in the mirror?
Nope.
No. Have you had an upset stomach, nausea, vomiting, any kind of diarrhea?
Nope.
Night sweats?
Nope.
Any weight loss or unintended weight loss?
Nope.
Anybody around you sick?
Nope.
No. Okay. Alrighty then. So what I'm going to be doing is a head, eyes, ears, nose, and throat examination. It is for educational purposes, so you're going to hear me explain things that you might not always hear in a medical professional's office. So to begin, we are going to start with washing my hands again because there's the hair up. With assessing your face. I'm looking for symmetry, I'm looking for lesions, I'm looking for color. You're tan throughout. I don't see any obvious lesions. You don't appear to be moist, diaphoretic, any kind of issues like that. Your facial hair is well dispersed, no patches. There is a receding hairline on your hair. Your eyes look very symmetrical. Your nose is symmetrical. Your outer eye fold lines up with the top of your ear fold. Now that I have examined you and inspected you, I'm going to palpate you. So I'm going to lay my hands on you. What I'm doing is I'm looking for any lesions, any abrasions, any nodules, any lumps, any depressions, any pain, anything like that.
Nope.
All right, I'm going to feel for your pulses. Your temporal pulses, they are about a +2. Any pain?
No.
No. Okay, there's no cording either. So your hair texture is very, very fine. It feels all uniform and there's no pain. Alrighty. So the next thing on your face, I'm going to assess your cranial nerve number 7, your facial nerve. Can you give me a big smile? Thank you. Can you raise your eyebrows? Can you puff out your cheeks? Good. So that was your facial nerve. With your cranial nerve number 5, your trigeminal nerve, go ahead and open and close your mouth for me. All right. There's no crepitus. There's no clicking. Any pain with when you chew?
Nope.
No. Okay. So the motor function of your cranial nerve number 5 is intact. So it is a dual nerve. It's motor and sensory. So I'm going to have you close your eyes and I'm going to perform a test. I'm going to touch your face in 3 different places. Tell me where you feel it and if it's soft or sharp.
Soft forehead, left side.
Okay.
Soft cheek, right side, or left side.
Okay. And again.
Soft left jawline.
Again.
Soft right forehead. Right cheekbone, soft. And soft right jawline.
All right. And then I would do it again with sharp stimuli, but I don't have anything to poke you with. Alrighty. Go ahead and open your eyes for me. So next I will palpate your lymph nodes. So I will start with your postauricular, which is behind your ear, going down to your occipital, going in round movements, feeling for any kind of lumps, bumps, any swelling, inflammation, any pain. So back to your preauriculars, going down to your submandibulars, your submentals, and then going to your anterior cervical. I'm going to do them twice because you have superficial and deep, so I can get in the big deep ones. Go ahead and hunt your shoulders for me. I'm feeling these supraclavicular ones. All right, and relax. I don't feel any kind of swollen lymph nodes there. Next thing I'm going to do is I'm going to move on to your ears. First, you inspect them. They are symmetrical. They don't appear to have any obvious lesions. No cerumen on the outside. There are some cilia present. So next I'm going to palpate. I'm feeling the pinea, the tragus, the antitragus, and the mastoid process. Any pain with when I touch here?
No.
No. All right. If there was, it would be indicative of an external ear infection, which there isn't. So I am going to look in your ear. I'm going to look for where the light bounces off of your tympanic membrane. I'm going to look at your tympanic membrane. So to assess for an adult, you pull out, down, and back. And insert. He has a lot of cilia present. His tympanic membrane is clear. It's patent. The light is shining kind of at the 5 o'clock position. I see the malleus behind the tympanic membrane, and it looks good. All right, I'm going to move on to the right side. Same thing, out, down, and back to straighten out the external ear canal. Advance my thing. The light reflects on the, I would say like 4:30 position, a little bit more off than the left side, but tympanic membrane is clear. It is pearlescent. You can see the malleus, and I'm pretty sure the ink is in there. So next, we are going to assess cranial nerve number 8. We are going to do the whisper test to assess your hearing function. So go ahead and cover your right ear for me. I'm going to whisper a sentence, and I want you to repeat it back to me. It's snowing outside.
It's snowing outside.
Good. We're going to do the same thing on the other side. It's sunny outside.
It's sunny outside.
Awesome. Alrighty, so then next thing we're going to do is we're going to do the Weber test. We're going to look for lateralization. I'm going to strike my tuning fork. I'm going to place it on your forehead, and you let me know if you can hear it equally or if you hear it on one side more than the other, okay?
Yep.
Equal, okay. So next we're going to move to the Rhine test. I'm going to strike it. I'm going to put it on your mastoid process behind your ear. And let me know when you can't hear it or feel it anymore.
Can't hear it anymore.
Okay, can you hear it now?
Yes.
Okay, good. And we're going to do the same thing on the other side. Ready? We're going to strike and put it in the back. Tell me when you can't hear it anymore.
Can't hear it anymore.
Okay, can you hear it now?
Yes.
Okay. So that means that your air conduction is greater than your bone conduction, which is a normal finding. Next thing we're going to move on to are your eyes. So I am going to inspect your eyes. I'm going to look out at the outer structures. You do not have any ptosis. You don't have any edema. Your eyelashes are everted, so they're coming out. I don't see any ulceration, any drainage, any discharge. Your sclera are clear. No jaundice or anything like that. I'm looking at your conjunctiva. You're gonna feel my hands. You're gonna look down. I'm sorry, look up. You were right. All right, and then look down. Good. Nothing there. I'm gonna assess your cornea. I'm gonna look from the side and look straight ahead for me. I'm gonna look. That is very clear. It is even. Look straight ahead for me, please. There's no lumps, there's no bumps, there's no signs of ulceration on this side. And then doing the same thing on the other side. Great. All right, so it's nice, rounded, clear, no lumps or anything like that. Next thing I'm going to do is I'm going to assess for convergence. I am going to have you follow my finger. I'm going to bring it towards your nose. Just use your eyes, don't move your head. Follow my finger. Good. Excellent. All right. So now for accommodation, your cranial nerve number 2, I'm going to have you look off into the distance, and then I'm going to have you look at my finger. Now look at my finger. Okay, great. Now off to the distance again. When he looks off to the distance, his pupils do dilate, and then when they come back to my finger, they constrict. They both are symmetrical. They converge at the same time. So that is his accommodation. We're gonna we're gonna assess cranial nerve number 3, your ocular motor. We're gonna assess the 6 cardinal positions. So follow my finger, please. Good. 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 All right. Okay. Cover your left hand with your left eye with your left hand. I'm going to cover my left eye as well. Let me know when you can see my fingers coming into your peripheral.
Yes. Yes.
Okay.
Yes. Yes.
Okay, good. Now with that hand still covering your eye, I'm going to hold up fingers. You let me know what you can see.
4.
Good. Now we're going to move on to your other eye. Cover up your right eye for me. I'll cover my eye as well. Tell me when you can see my fingers in your peripheral.
Yep.
Okay.
Yep.
Okay.
Yep.
And again. Yep. Good. All right. Now keeping your hand covering your eye, tell me how many fingers you see.
4.
Good. All right. Hands off your eyeballs. We are going to do the Rosenberg test. It is a deviation of the Snellen chart. Oh, crap. There it is. Okay. So hold it away from you, please. And can you read the line above the green, please?
Yep. DEFPOTEC.
Alrighty, so that's great. Next, we're gonna do the Ishikara colorblind test. Ishikara. All right. So, tell me what number you see.
12.
What number?
8.
What number?
6. 29.
Oh.
57.
And she passed with that. So now we are going to move on to the eye exam with my light source. So we're going to inspect the cornea. We're going to look for where the light hits on it. It's called the Hirschberg test, and it would let us know if there was any astigmatisms or anything that would affect where the light is hitting on his pupils or cornea. So it looks right at me. Okay, good. Good. So it hits him in his pupil, kind of at it's in the middle. And that's a cat. Good. I'm gonna check for direct and indirect or consensual responses to his pupils, which is, I think, cranial nerve number 3 or 5. So I'm gonna shine the light in his left eye once and then again and look in the right eye. So for direct stimulation, he goes from a size 4 to approximately a size 2. And then again, his right goes from about a 4 to a 2. And I'm gonna do it again on the other side. 2 and a 4. All right, great. So next I'm going to look for the red light reflex. I'm going to shine my light in his eye, and his pupil lights up a nice reddish orange. And again, so then I'm going to do a fundoscopic exam. I'm going to look on the inner structures of his eye. I'm going to look for the optic disc, the cup, the macula, and the vasculature. So with my left eye, I'm going to look into his left eye. So kind of gaze off into space for me there. You gotta look at that nice red reflex. Don't keep your eye open, you goose. Oh, rats, I lost it. There we go. Alrighty, so his optic nerve is kind of like at 7 degrees towards his nasal aspect, his optic disc, and his macula is to the left lateral temporal. He's got about a 2 to 3 with his arteries and veins. His veins are a little bit darker than his arteries. Sorry, was that really bright? Alright, so same thing. I'm going to use my right eye to look into his right eye. Look off into the distance, please. Alright, red reflex is present. Look off into the distance, please. So we're going to zoom in. You got to open your eye. Look up in the distance, please. Open. Can you point your eye down? Alright. So good. No, stop. His optic disc and nerve are towards 4 o'clock on the nasal aspect. That's just right. There we go. His arteries and his nerves are about a 2 to 3 ratio. Good. Beautiful. I don't see any cotton wooling, any kind of deviations, any ulcerations, anything funny or funky in there. Did I check your conjunctiva? I'm going to check them again. No pallor, no cyanosis, nothing there. Any pain around your eyes?
No.
No. Okay, great. So that was your eyes. We did your ears. Did I feel your face when you chew? Chew for me. Checking his masseter muscle. Making sure he can chew. Good. Alright. Moving on to your nose. I'm looking for symmetry. It is pretty symmetrical. His skin looks to be intact. There's no lesions. There's no deviations. I don't appraise any abrasions. I'm going to have him put pressure on one nostril. Breathe in. Good. Next nostril. Good. His airways are patent. You okay? I'm going to look into his nose to appraise his turbinates. Going to look at the mucosa, look at the cilia, make sure there's not any discharge. Tip your head up. Okay, great. His turbinates are pink. They're moist. They're intact. There's no drainage. Cilia are present. There's no ulceration or inflammation. There's no discharge. I'm going to palpate his sinuses. Any pain? Any pain?
No.
No. Okay. Keep your eyes closed for me. I'm going to assess cranial nerve number 1, your olfactory nerve. Can you smell this?
Mm-hmm.
What is
Cinnamon.
the smell? It is cinnamon. Good. Alrighty. So open your eyes for me. So we did your face. We did your eyes. We did your ears. We did your nose. Now I'm going to go down to your mouth and your throat. So I'm inspecting the outside. His lips are pink. They're moist. They're intact. There's no flaking. There's no ulceration. They look pretty well kept. Can you show me your teeth? Beautiful. His teeth are intact. There's no signs of dental caries or anything like that. All right, open your mouth for me, please. Alrighty. So I'm looking at his buccal mucosa, which is intact. Look up for me, and now stick your tongue out and say ah. Stick your tongue out all the way and say ah. Alright, his tonsils do not extend past the pillar, so I would give them a grade of a 1. Say ah. His uvula and his soft palate and his hard palate, they're all vibrating in place. Stick your tongue out for me. So for cranial nerve number 12 is hypoglossal nerve. He does have papillations on his tongue. There's a thin white coating on there though. Just move your tongue from side to side for me. Up and down. Glorious. So I'm going to look for the parietal and the Stenson ducts that are going to be by the second molars. All right, open. Good. 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 Now lift your tongue up for me, and I'm gonna look at your Wharton gland. Good. That's where your saliva kind of comes out. All right. I'm gonna have you stick your tongue out. I'm gonna look at the lateral aspects of your tongue because that's where the most masses would form if they were gonna happen. All right. I'm gonna feel under your tongue. Look for any lumps or bumps. Good. I don't feel any. I would assess cranial nerve number 10, which is your vagus nerve, but I'm not going to make you Ralph. So that's the oral. I'm going to go on to the neck. I'm going to look at the neck. It is symmetrical. I'm going to palpate his thyroid. Go ahead and swallow for me. Good, and again. All right, his thyroid is not enlarged. His trachea is midline. There are no deviations. I'm going to feel his carotid pulses while I'm here. Good, and again. Great. I'm going to have you turn your head. God bless you. I'm going to have you turn your head from side to side. Good, up and down. All right, push your hand against my hand. Good, and the other side. Excellent. Shrug your shoulders up. All right, great. I'm gonna listen to your carotids, and then I'm gonna listen to your heart. We're gonna listen for any bruits. Now I'm going to listen to your heart. I'm going to listen to your aortic, your pulmonic, your herbs, and your tricuspid, and then your mitral valve. So your aortic is 2 intercostal spaces on the right, followed by your pulmonic, which is 2 intercostal spaces on your left. Your herbs is 3 down, your tricuspid is 4 down, and then your mitral is 6 down with your midclavicular line or right below your nipple. You just breathe easy for me. Good. So his carotids had no bruits and they sound within normal limits. I didn't hear any murmurs. I didn't hear no rubs, no gallops. I heard a perfectly acceptable S1 and S2. Now I'm going to get my screen back. Where's my video? There it is. I'm going to listen to your lungs. Breathe in nice, big, and deep. And then 3 on the right. Good. Two more. Good. Alrighty, so your lungs are clear. There was no rhonchi, there was no rales. You had bilateral lung sounds. I'm gonna look at your hands. Your nail beds are pink. There's no cyanosis. You have a capillary refill of less than 2 seconds. They're well maintained. The nail degree is about 160 degrees, which is well within normal limits. There's no clubbing and no nodules or anything present. With your cardiac, I would look for jugular vein distension. I would measure while you're sitting straight up, and then I'd have you go back 30 degrees and measure it again. However, that doesn't go back 30 degrees. So in a summarization of your assessment, you are having a sore throat. There is no redness, no inflammation of your tonsils or any of your lymph nodes right now, but we can try over-the-counter methods. We can swab for strep. We can do a throat culture, and we can let you know if those come back positive. If they do, we can start you on an antibiotic. Until then, symptom management. It could be just kind of a viral pharyngitis or something going on like that. Increase your water intake, salt water gargles. Instead of Tylenol, try an over-the-counter NSAID like naproxen, Aleve, Motrin, Mobic, anything like that, because it is an anti-inflammatory in addition to an anti-pain medicine, and we'll let you know about your results.
Okay.
Okay.